If you have a child who you feel like has ADHD, or you already determined that they do in fact have ADHD, there's a variety of ways that it presents, not just in hyperactivity. It could also be in an inattentive type. So don't get caught up in just thinking it's hyperactive. But you might be wondering, what are some of the things that could be used medically and by other health professionals to treat ADHD? One of the most common ones is stimulant medications, and there are biological reasons for that with neurotransmitters that we have that help a person, have a calmer state and be more focused. And sometimes that works for people and sometimes it doesn't. But that's kind of the main treatment right now as far as what the medical community will advise. But there are other behavioral and non-medical, meaning non-medicine based options for children and even adults that feel like they have ADHD. So hopefully that's helpful just to give you an idea. Medication's kind of the first go-to, but if you don't want to go that route, there are other options to explore. Some of the other interventions include behavioral based training, parent trainings. Obviously, getting yourself more educated as a parent is going to do a lot of good to be able to try and address what's going on with your child, or even yourself if it's you who are dealing with this. Besides behavioral and parent training, you might be doing some training with psychological services. It might be a psychologist or someone who has specific techniques or programs that address some of the root causes of ADHD, or some of the main things that are impacted by those causes. Other professionals, such as people like myself, who are pediatric occupational therapists, we look at things from a functional perspective. So, what is it that a person actually has to do? For a student, that might be, being able to focus in school or being able to focus at home. And because they're not able to do that, they're not getting good grades, and that's impacting their ability to get the education they need. There's a lot of things that might be impacted. So we look at those things that are impacted on a case-by-case basis through evaluation, and then we come up with a customized plan to help kids address the challenges. Some of those challenges might be organizational in nature. Some of those challenges might be with, they're more impulsive. Some of those challenges might be a variety of other things. But when you're looking for help to support yourself or your child with ADHD, don't just look at medicine alone, because there's a lot more that needs to happen than just taking the medicine in most cases. So hopefully this has been helpful. This is just education, not medical advice in any way. Seek out your local health professionals and specialists that can help you get a handle on this, but tune in here for more insights and education in the future.